Welcome to our video on epidemiologic study designs. This is a fascinating and crucial topic in the field of public health. Epidemiology, the study of how disease spreads and can be controlled within populations, is the backbone of public health. It allows us to understand how and why illnesses occur, and importantly, how we can prevent them. One of the primary tools we use in epidemiology is study designs. These designs are the frameworks that guide our research and help us answer critical questions about health and disease. So, what are these epidemiologic study designs? They are essentially blueprints that guide researchers in collecting, analyzing, and interpreting data. They help us to understand the complex relationships between risk factors and health outcomes. In this video, we'll be exploring the different types of epidemiologic study designs, from descriptive and analytical to experimental, observational, and interventional. Each of these designs has its own strengths and weaknesses, its own best uses, and its own unique approach to unraveling the mysteries of disease. Descriptive studies, for instance, help us understand the who, what, when, and where of health events. Analytical studies, on the other hand, delve into the why and how. Experimental studies involve interventions and control groups, while observational studies watch events unfold naturally. Finally, interventional studies actively seek to change outcomes and provide the strongest evidence of cause and effect. Remember, each design serves a different purpose and is chosen based on the research question at hand. So, understanding each design's strengths and limitations is key to interpreting study results and applying them in real-world settings. As we delve into each of these designs, we'll explain how they work, their advantages and disadvantages, and how they contribute to our understanding of disease and health. So, buckle up, because we're about to embark on an exciting journey into the world of epidemiologic study designs. Stay tuned as we dive deeper into the different types of epidemiologic study designs. Let's start with the first type of epidemiologic study design: descriptive studies. These studies, as the name suggests, are all about describing. They provide a snapshot of a situation or condition, often in relation to a specific population at a particular point in time. Imagine you're a detective trying to solve a mystery. Descriptive studies are like the preliminary investigation. You're collecting basic information about the case, where it happened, who's involved, and when it occurred. You're not trying to figure out why it happened just yet. That's for later. In the realm of public health, descriptive studies are used to understand the distribution of diseases or health-related events. They help us answer questions like, what is the condition, who is affected by it, where are they located, when did it occur? For instance, consider the case of a flu outbreak. A descriptive study might reveal that the flu is most prevalent among children aged 5 to 10 in a specific town during the winter months. This information is crucial in identifying trends and patterns, which can guide public health interventions and policy decisions. However, descriptive studies have their limitations. While they give us valuable information about the what, who, where, and when, they don't delve into the why. They don't tell us why a certain disease is more prevalent in a particular group, or why it occurs at a specific time. For that, we need to turn to another type of epidemiologic study design, known as analytical studies. So, in a nutshell, descriptive studies are like the first stepping stone in epidemiologic research. They lay the groundwork for further investigation, providing us with a clear picture of the health problem at hand. But to fully understand the causes and effects of health-related events, we need to delve deeper, and that's where analytical studies come in. Descriptive studies give us the what, who, where, and when. But to answer the why, we need to look at analytical studies. Next, we're discussing analytical studies. These studies help us understand the why behind health outcomes. Analytical studies are a crucial part of epidemiology. They are the tools we use to unravel the complex web of factors that contribute to health outcomes. They dive deeper than descriptive studies, seeking to explain the relationships, patterns, and potential cause and effect scenarios. Analytical studies come in two main types: case control studies and cohort studies. Let's break that down a bit. In a case control study, we start with an outcome, such as a disease, and work backwards to find associated factors or exposures. It's like being a detective, starting with a crime scene and working backwards to find out what happened. On the other side, we have cohort studies. In these studies, we start with a group of individuals who have been exposed to a certain factor, and a group who haven't. We then follow these groups over time to see how the health outcomes differ. It's like planting two sets of seeds in different conditions and seeing how they grow differently. Now, why are analytical studies so important? Well, they provide the evidence we need to make informed decisions about public health. They can help identify risk factors for diseases, evaluate the effectiveness of a health intervention, or even uncover unexpected effects of a treatment or exposure. For instance, an analytical study might explore the link between smoking and lung cancer, or it might investigate whether people who exercise regularly have a lower risk of heart disease than those who don't. Analytical studies are not without their challenges, though. They require careful design, meticulous data collection, and thoughtful analysis to ensure the results are valid and reliable. And even then, they can only show associations, not prove causation. But they are a key piece in the puzzle of understanding health and disease. Now that we've covered the why, let's move on to experimental studies, which test our hypotheses. Now we're on to experimental studies. These studies are where we put our theories to the test. Experimental studies are a fundamental part of epidemiology. They are designed to test hypotheses and establish causality. This is where the rubber meets the road, so to speak. It's where we take the theories and observations we've gathered from the descriptive and analytical studies and try to prove them in a controlled environment. In an experimental study, researchers have control over the study conditions. They decide who gets exposed to what and when. This control allows them to isolate specific variables and observe the effects. Think of it like a scientific experiment in a lab, but in this case, the lab is the real world. Let's consider an example to illustrate this. Suppose researchers want to study the effect of a new vaccine on a specific disease. They would conduct an experimental study where they divide the participants into two groups. One group receives the vaccine and the other does not. By comparing the incidence of the disease in these two groups, researchers can determine whether the vaccine is effective or not. However, it's important to note that experimental studies come with ethical considerations. In our vaccine example, it would be unethical to knowingly expose participants to a harmful disease without their informed consent. Therefore, these studies must always be conducted with the utmost care for participants' rights and well-being. Experimental studies also have their limitations. They can be expensive and time-consuming. They may also not be feasible in certain situations. For example, it's impossible to conduct an experimental study on the effects of smoking because it would be unethical to ask people to smoke for the sake of an experiment. Despite these challenges, experimental studies are invaluable in the field of epidemiology. They allow us to test theories and develop effective interventions to improve public health. Experimental studies are a vital tool in epidemiology. But what happens when we want to combine the strengths of descriptive and analytical studies? That's where observational studies come in. Our next topic is observational studies. These studies combine the best of both worlds, descriptive and analytical studies. Observational studies are a type of research design where investigators observe subjects and measure variables of interest without assigning treatments or interventions. They are usually used when conducting an experiment isn't ethical or practical. Think of observational studies as the detectives of the research world. They're not about changing anything or interfering, but rather, they're about quietly watching and gathering data to help answer our research questions. Observational studies have a broad purpose. They can describe the state of affairs as they exist, explore associations, or investigate the causes of a particular outcome. Now, let's dive into some examples. One of the most common types of observational studies is the cohort study. In this, a group of people sharing a common characteristic or experience within a defined period are observed. For instance, a study might observe a group of smokers over a decade to study the long-term effects of smoking. Another example is a case control study. Here, two existing groups differing in outcome are identified and compared on the basis of some supposed causal attribute. For instance, a study might compare lung cancer patients with a group of healthy individuals to see if there's a significant difference in smoking habits. Lastly, we have cross-sectional studies, which capture a snapshot of a population at a single point in time or over a short period. It's like taking a group photo of the population and then studying the characteristics of the individuals in the snapshot. Observational studies help us make connections and identify patterns, but to establish cause and effect, we need to look at interventional studies. Finally, we have interventional studies. These studies are all about testing interventions and their effects. Interventional studies, also known as experimental studies, are unique in the world of epidemiological study designs. Unlike other study designs that observe and analyze, interventional studies take a more active role. They implement a change or an intervention, and then watch to see the effects. Imagine a scientist in a lab, introducing a new variable into an experiment and then carefully observing the results. That's essentially what happens in an interventional study, but on a far larger and often more complex scale. The lab could be a community, a hospital, or even an entire city, and the variable could be a new drug, a public health campaign, or a change in policy. The purpose of interventional studies is to establish cause and effect relationships. They allow researchers to control the variables and measure the outcomes of an intervention, providing strong evidence of causality. For instance, a group of people might be given a new vaccine, while another group is given a placebo. Researchers then compare the two groups to see if the vaccine had a significant effect in preventing disease. Examples of interventional studies are abundant in public health. The polio vaccine trials in the 1950s, which involved millions of children, is one of the most famous examples. More recently, the clinical trials for COVID-19 vaccines are also examples of interventional studies, where different vaccines were tested on large groups of people to determine their efficacy. In conclusion, interventional studies help us establish cause and effect relationships and are a key tool in improving public health. We've covered a lot of ground today, exploring the different types of epidemiologic study designs. Let's take a moment to recap the main points. We kicked off our journey with an introduction to epidemiologic study designs, where we learned that these tools help us understand disease patterns and causes in a population. They're the backbone of public health research, and they're used to inform policy decisions and interventions. Then, we dove into descriptive studies. These are the groundwork of epidemiology, providing us with the who, what, where, and when of disease occurrence. They give us the first clues about potential causes and help us identify patterns and trends. Next, we tackled analytical studies. These designs are all about the why. They allow us to explore relationships and associations between exposures and outcomes. We learned that these studies can be either observational or experimental. Our exploration continued with experimental studies where we learned the power of control. These studies allow researchers to manipulate exposure levels and directly measure the effects. They're the gold standard for determining causality, but they're not always feasible or ethical. Moving on, we discussed observational studies. These designs are crucial in situations where we can't control exposure, and they provide valuable insights into natural disease progression. We also learned about the different types: cohort, case control, and cross-sectional studies. Finally, we delved into interventional studies. These designs are used when we want to test the effectiveness of a policy or treatment. They're all about implementing change and observing the effects. That's all for today's video on epidemiologic study designs. We've journeyed through the landscape of epidemiology, from describing disease patterns to analyzing causes and testing interventions. Remember, each design has its strengths and limitations, and the appropriate choice depends on the research question and context. Please feel free to post any questions you may have in the comments below. Your queries and discussions help us all to learn and grow. Don't forget to subscribe to our channel for more informative videos like this one. Thank you for watching.